streaming program with Eclipse CPR training in Tucson, Arizona. This will be a demonstration of infant CPR. Infants are birth to 1 year of age. This information can also be reviewed in your required Basic Life Support for Healthcare Provider textbook, which is required in all of your BLS programs. This is the latest 2020 guidelines for BLS for infant CPR. Number one, make sure the scene is safe. Number two, we should always check responsiveness. We want to know, is this baby awake, perhaps sleeping? Is the baby conscious or not? Number one, slap the foot or flick the foot with a finger. Baby, are you okay? Call for help, yell for an AED, and then check the pulse. The pulse on an infant is felt on the upper arm between the elbow and the shoulder with your fingers, never a thumb. When we feel the pulse, we can choose the brachial artery or the femoral artery, or some say the femoral artery, where the leg attaches to the torso. When we check the pulse on babies, the heart rate, if it's less than 60 and an infant has signs of poor perfusion, meaning they look blue or purple, you should immediately begin CPR. This is very important. When we assess the pulse, we can feel the pulse in two different locations. Why do we check a pulse? We hope the baby has a pulse. If the baby does have a pulse, and according to your algorithms in the 2020 American Heart Association BLS algorithm, if the heart rate is less than 60 and the infant has signs of poor perfusion, meaning they look blue or purple, we should immediately begin CPR. We usually place 2 fingers just below an imaginary line connecting the nipples together. Your book may illustrate the first finger, but you can use the first finger and the second, or perhaps the second and the third, placing that finger just below an imaginary line that connects the nipple lines together. If I'm by myself with an infant in cardiac arrest, I will deliver 30 compressions, and then I'll use the bag mask using a very little small C and a little letter E, which we will demonstrate in class, and give 2 gentle breaths. Only enough air for the chest to rise. If I was working with a second professional at any hospital or medical center in the United States, if there are 2 of us, we do not do 30 compressions and 2 breaths. We cut the compressions in half, and we most likely will use our thumbs, 2 thumbs, either side to side or 1 thumb on top of the other, and we deliver 15 compressions and 2 breaths. Yes, when you're sharing the work with another provider, we cut the compressions in half. This is because the most likely cause of cardiac arrest in infants is often respiratory related. Infants and children are often lower on oxygen than adults, so we cut the compressions in half to allow for the delivery of more oxygen. In infants, press at least 100 to 120 compressions a minute. Push at least 1/3 of the depth of the chest, about 1.5 inches. Each time you push down in the chest, you should let the chest recoil completely. Keep interruptions to less than 10 seconds. Per your new 2020 Healthcare Provider textbook, which is required, the American Heart Association says if you're by yourself, you can use 2 fingers, but they're also allowing us to consider, even when we're by ourselves now, to consider using 2 thumbs if that works best for you. And in the appendix section in the new book, it's also recommended, and this is new as of October 21st, 2020, that you can consider on large babies closer to a year using the heel of one hand if needed. We appreciate your time. We know you have a busy schedule. We appreciate you taking your streaming program with Eclipse CPR in Tucson, Arizona. Thank you so much.